So welcome, thank you for joining us today. We're here today to talk about considerations for long-term care, otherwise known as making the decision, and it's online, offered online. It's also being streamed live onto Facebook and can be accessed through our YouTube channel at the Dementia Society at Ottawa and Renfrew County. So every time we do a new presentation, we post this on our YouTube channel. So the first part of the presentation will be delivered by myself, Kelly. I'm a dementia care coach with the Dementia Society. And then the second half, well, more 2/3 of the presentation will be taken on by Elaine here, who works for the Local Health Integration Network in the Champlain region. And she's acting as a care coordinator for the presentation. So she's had experience within this role and responsibility. Oh, we also have Herman, but just to note, Herman is having some technical difficulties. So he may come in later into the presentation just to update on any new programs or services. I'm gonna click the arrow. Nope. Okay, that's okay. I'm gonna click the button. Great. So, oh goodness, no. My apologies, everyone. All right, so the clicker is it's very temperamental, and if I click it too aggressively, we kind of go a little bit too quickly. I'm trying to see how I can make it myself, but it's not available. So this slide is just to note that with dementia, needs and abilities will change throughout the journey and the life of dementia or the illness. So with normal aging, we do notice some memory loss associated with normal aging and advancement in your years. So an example of this is maybe going into one room and not recalling why you might have gone into that room. Next is mild cognitive impairment. So this is when we're seeing cognitive changes, and there might be some concern to closer family members. And these impairments or these changes are greater than what you would see in normal aging. So an example of this is someone who might have taken care of a complex activity, like managing and paying bills or managing finances. And you've recognized that they're unable to do all of the steps of that task. For instance, going to the teller, bringing the bills necessary, the amount that you're going to be paying, so on and so forth. So sometimes there's some confusion with some of the steps within the task, or they may need some additional support. So activities of daily living are intact. So there are instrumental activities of daily living, and there are basic activities of daily living. So activities of daily living are dressing, eating, walking, morning routines, medication compliance. These are some of the activities of daily living. And by medication compliance, I mean managing and taking your medication on time and completing refills and so on. So at the MCI stage, we may notice that this person needs additional support in independently completing some of these activities. Not necessarily the dressing, the bathing, but more to do with the complex activities. So if we move further, then we see dementia. So cognitive impairments are severe enough to interfere with those activities of daily living, like dressing, eating, walking, and more support is needed. So this is just to show that there's a change in needs, and also that means that more intense care may be needed to address those needs, or supervision may be required to reduce safety risks. And that's just sections of the brain. So different parts of the brain control different areas of the body and the mind. Oh, so sensitive. We'll just go back. So when you're contemplating a move into long-term care, or a move in general, or you need more assisted care, I think the main goal is that most caregivers and loved ones want to make the best decision for that person. So there can be a lot of different feelings that are associated with making this decision, being responsible for this decision, or just having input. Some caregivers have said, learning all about this, the long-term care, assisted living, it's very overwhelming. I'm feeling guilty, that I have to be at this point, and guilty that I have to maybe put somebody into long-term care because of their needs and safety, as opposed to maybe their want or desire to make a move. A lot of times we have to act in their best interests and consider where they're most safe and where they'll be able to thrive a little bit better with 24-hour nursing and supervision care and personal care, excuse me. So, while you're contemplating this decision, or you're informing yourself about making this decision, really important to, either connect with someone like myself, who's a dementia care coach, if you have a counselor, or just friends and family to kind of talk through some of these feelings. If you're a little bit more of a private person, journaling when you have 5 minutes or so is really helpful to get out some of the emotional reality of the situation as you're trying to prepare and organize things so that your loved one is safe and their personal and health needs are taken care of. So a lot of different emotions, depending on who you are, depending on the relationship, depending on the prior conversations that you had, it may be different for everyone. And this decision is very personal. And so, what might be right for one family would not be right for another. So I'm going to very gently move to the next slide. Not gentle enough. So there's a few, and we call them caregiver challenges, but just some flags or some things to consider that are informing you to make the decision or to make a move. So if the person is living at home, there could be some emerging safety and health issues. One, if they've had prior incidences using the stove, kitchen equipment, microwaves, are they, capable of knowing and calling emergency services if a fire emerged or if something were to happen? Do they know to go to a particular person? So if they're having, numerous and frequent falls that are causing trauma or mobility issues. Another one is not able to meet care needs and provide supervision. So as we know with dementia, it does unfortunately progress, and so the care needs and supervision needs will increase. So, depending on what your life is already filled with, you might not be able to meet all of the care needs or provide the recommended supervision. And we'll talk about some other options before considering long-term care that you could use and implement within the home to help with some of these emerging safety and health issues. And another one to keep in mind, or another tip to keep in mind, is recommendation. If your doctor is recommending that there's 24-hour supervision, or that their care needs are increased, a move might be necessary, this is a pretty good indicator that thinking about long-term care in home supervision is the right step forward. So say you're providing care for your loved one, you know, the needs are increasing, you're helping with dressing, meal preparation, hygiene rituals like baths or showers, keeping them stimulated over time. This can create fatigue, compassion fatigue, burnout, exhaustion. And there are some short-term respite options that you can use to help take a break. But also, you know, knowing your own capacity is also a good indicator to tell you if a move to assisted living or having regular short-term respite or considering long-term care where 24-hour nursing and supervision can take place. Also, if your loved one is living with their spouse inside of the home and that primary caregiver becomes ill or transfers to the hospital, or there's some mobility issues of that caregiver, or even their capacity has changed, this might be another indicator for considering assisted living, in-home supervision, or long-term care. So the final one I wanted to mention is medical attention is needed more often because it's provided in-house. So it's really nice to know supervision, medical attention, medication compliance or medication administration is offered, you know, some social and program activities. So thinking about these 4 points within your situation, it'll kind of tell you where to move forward and what kind of resource you might want to implement into your home or considering making a move. Right, so emerging safety and health issues, not able to meet care needs or provide supervision, illness, or there's a change in mobility of the caregiver, or if there's, you know, long-term fatigue, exhaustion, burnout, medical attention is needed more often for your loved one, or supervision. So before considering long-term care, and Elaine will really talk to you about the different eligibility criteria and what that whole registration or application process looks like. But there's some things to consider before long-term care, and one of them is in-home support, so either private or public. And some examples are right underneath that orange tab. And if you notice, there's a little star next to some of those that are listed. Those services are provided by community organizations. They're not necessarily found in the local health integration network, but they can definitely refer you to some options. Excuse me. So I know of some caregivers and persons with dementia that have kind of compiled their own little care plan based off some of these examples and created a care system that's at home by coordinating, say, you know, foot clinic that comes once every 2 months, light house cleaning that's twice a month, home maintenance when repairs are required, hot meals delivered to the door with a bit of a conversation, and then seasonal snow removal. But some other really important services that are offered are personal support workers, occupational therapists, physios, live-in caregivers are also available that can provide 24-hour care and supervision, nursing that would visit you at home, and also, I believe, I might be wrong, but fall detection or I think that falls under occupational therapy. So, you know, depending on you know what your family would like to do in regards to the care and the wellness of your loved one, you might want to try some of these services in combination before applying for long-term care. Elaine will also note that and explain that it's more of a daily need for activities of daily living that would be more suitable for long-term care. So if you're helping your loved one, you know, dressing every day, feeding them every day, bathing them a couple of times a week or every couple of weeks, you know, providing this, you know, runs the gambit. Oh, sorry about that. All right, so in-home support, that's right, in-home support. So the LHIN can provide a personal support worker after an assessment has completed, and it's really important for you to be able to, you know, list some of those daily needs of your loved one. There's also, so since, you know, COVID and the pandemic has happened, there has been less day programs obviously available. There are some friendly alternatives that are virtual. The Dementia Society offers a virtual respite program where they match a volunteer with similar likes and dislikes to your loved one. And then, you know, depending on when you want to connect, you can have friendly phone calls, you know, talk about different things that your loved one enjoys, their history, their past. And these volunteers are dementia friendly trained. Yeah, so that's one example. There's also telephone assistance programs, and this is where they can check in on your loved one to see how they're doing and relay back any information. There's also short-term respite. So there's a few different options here. So the guest house, that's provided by Care4, and they also offer in-home supports and services. Long-term care also offers short-term respite at a fee. And of course, assisted living can also offer short-term respite. But that might take you having a one-on-one conversation with the director of care. And trial or error, you know, seeing who will accept a short-term respite. There's also retirement homes or assisted living facilities with dementia floors or dementia care. So this is a more secure floor that may offer dementia special medical care. And of course, there's also assistive technology. So on Amazon, there's a lot of different options. There's also the Alzheimer's store that's available in Canada, and they offer different options for assistive technology. So fall detection monitors, alerts or alarms, GPS insoles, what else? Also larger alarm systems like a clock that has a larger face, phones that have larger buttons. So kind of going through this checklist and seeing what can be provided in home before making the decision for long-term care is a good step in the LTC or the long-term care process. And I'm just combing my mind to see if there's anything else that I can include. Nope, I think that really covers it. So in-home support, either through the local health integration network of the Champlain region or through private companies that offer in-home support and care, recreational programs and activities, short-term respite, retirement homes or assisted living facilities with dementia floors, and assistive technologies. All right, so there we go. I was a bit tongue-tied all. Sorry. There we go. We talk for most of the day, so by this time I get a little tongue-tied, and I apologize. So I hope you are getting pieces of information that are helpful for you, and you forgive my rambling. So one thing to remember is that relocation and making a move is really stressful for anyone, whether you're type A, type B, or you have dementia. We have to consider this and put ourselves in that person's shoes of what would be most comfortable or reassuring to have when you're either maybe having that conversation with that person and planting a seed, or waiting for something to happen and then using that to open up the conversation. We always want to be mindful that this is a very stressful time, and warmth and reassurance can be really helpful in getting through, either this conversation or making the move itself. We also have to be prepared for a period of adjustment too. This may be longer for somebody who has dementia, or it may be a lot shorter. Some individuals really do well as when they move into this new community and their care is provided for, supervision is there. And some people take just a little bit longer. So you might hear, I want to go home, or when are you taking me home? And that can be really hard to hear, but it's important we think about those challenges, those things that we're kind of being mindful of that informed our decision to make the move, or even to have the conversation. The person with dementia is unable to problem solve or judge when it's time to move. So, this really depends on who your loved one is, but there might be a challenge of insight, so not being able to be aware of your challenges and what supports or solutions you need to take on to remedy or help with some of these challenges. So that's when we come in and we act as that person's advocate and their wishes. And we try to remember their safety and their health needs as well. And finally, always remember it is a matter of health and safety. I think I trailed off into that a little bit. And even when you're starting to provide supports in home, you want to start off slowly. You want to, introduce that person to your loved one and ensure that you're respecting, who they are as an individual and that it's their home. And you want to do a warm kind of transfer. And just kind of see what's next here. Oh, these videos do a little bit better of a job. So they'll explain, so these 3 videos are posted on our website, but they're also posted on our YouTube channel. And it's a 3-part series. It's preparing for the move. So before the move is actually happening, how to, what things do you keep? What things do you keep with the person as you're in the day of the move? And then how to adjust afterwards. So this will help you if that person is having a difficult time adjusting afterwards. So how a dementia care coach can help. We do help with, keeping you organized, although I feel like I was a little disorganized there, but we do help you kind of plan things out, consider all of the options that might be available in your community or area, and help be that sounding board with you when you're going through some of these options and what might be the best fit for your family. So it says, we are here for you. We are your own community of support. So when caregivers are struggling to cope, we are here to help you find care, education, and respite you need. So if caregivers or persons living with dementia have questions and cannot find answers, we will take the time to help them understand. So we do have an intake line that's available from 8:30 to 8 p.m. except for Fridays. And even if it's a one-off question or you feel like this is a silly one, there are none for us. Please do give us a call and just let us know where you are and how we can kind of help, and we'll be there to guide you in whatever step or phase that you're in with this. Okay, so this is our phone number for Ottawa and Renfrew County, our email, as well as our dementiahelp.ca website. The website has been revamped quite a few times over this last season. And so there is a virtual tab or section where you can kind of learn all of the things that we would have presented in person in, long ago in 2019. So do take a gander at the website. There's also a chat option. So if you feel more comfortable in just typing up your question or, typing up your request for support, then that's okay too, and you can do it through there. All right, so I know Elaine is going to do a great job in the next part and explain LTC a little bit, long-term care in a little bit more clearer way. So I'll stop everybody's suffering and I'll pass it off to you, Elaine.
Thanks, Kelly. I don't think anybody's suffering. All right. Well, thanks everybody for joining us tonight. So yeah, I'm going to move on to talk about resources and information about long-term care, and a little bit about the Champlain LHIN, just as an introduction. So the Champlain LHIN covers quite a large area. Besides just the Ottawa area, we cover all of eastern counties. That's Prescott, Russell, Stormont, Dundas, and Glengarry. We also cover all of Renfrew County, so out west up to Pembroke, Deep River, Renfrew, Arnprior, all those places. And then we cover some of North Lanark, North Grenville, so places like Carleton Place and Kemptville area. So as you can imagine, it's quite a big area that we cover, and that's what we mean when we say the Champlain Local Health Integration Network. It covers this area. So we do offer home and community care services, which are covered by OHIP. So some of the professional services we provide include care coordination, and what that means I'll talk a bit more about in the next slide. We also offer nursing services, so those might do things like administering intravenous medication or changing a bandage for a wound. We offer nutrition services, so those are provided by registered dietitians. They might look at people who have a new diagnosis of cancer or diabetes or something like that and make some recommendations. We have occupational therapists who work with people who may have had strokes or need adaptations to help access their home or their kitchen or their bathrooms, things like that. Physiotherapists who help people with exercises, range of motion, maintaining their mobility. Speech language therapists who help with things like not just speech and people who are having difficulty with speech, but also anybody that's having swallowing issues. So again, it might be people with strokes or cancer and things like that. And we also offer social work services. So social work services might help people who are struggling with finances, who are struggling with abuse or complex family dynamics or issues. And again, these services are all free of charge and covered by OHIP if you're determined as eligible for them. We also offer support services. So personal support services is our biggest service that we provide basically. So it's helping people that need help with those activities of daily living that we talked about. So somebody who needs help with bathing, with dressing, with getting out of bed, with getting to the bathroom. Those are things that our personal support workers can help with. They can also provide respite care. So for somebody, for example, with dementia who cannot be left alone, then a personal support worker could stay with that person to give the caregiver a chance to get out, run some errands, do stuff like that. We also offer medical supplies that are related to the service we're providing. So as we mentioned, if you have a nurse come to the home to change a bandage for your wound, then we would provide the supplies for that bandage. Equipment we can provide on a trial basis for a couple of weeks. Basically, it's just to give people a chance to try a particular piece of equipment and decide if it's right for them. And if it is, then you can go ahead and either rent it or purchase it yourself after that. And if you have to purchase it, there are some programs that will help with the cost of that if needed. And then medication. So anyone that's receiving a professional service through home and community care is entitled to an Ontario drug benefit card, which basically means that normally you should be able to get your medications with just a charge of $2 per prescription. We do have some special needs services as well. So palliative care services for people at the end of their life, school health support services that help support children in school. Rapid response nurses see people that have just been released from the hospital. So their goal is to visit within 24 to 48 hours to make sure that transition from hospital to home is as smooth as possible, to make sure that you have any new prescriptions that you need, to make sure you understand any new diagnoses, to make sure you have follow-up appointments scheduled with your family doctor, those sorts of things. We offer geriatric assessment services in the Eastern Counties and Renfrew County. In the Ottawa area, it's provided by the Geriatric Assessment Outreach Team out of either Queensway, Carleton, or Briere Hospital. But in Eastern Counties and Renfrew County, geriatric assessors are employed directly by the LHIN, and they offer a similar service where they will assess people either in their home or at a clinic. Again, these are mainly people that might be having memory issues or some other struggling at home. So they would assess them and make recommendations in terms of what could help these people to manage at home as long as possible. And then our wound care services. So all of our nursing agencies have nurses that are trained in wound care. Wound care is actually, again, a big part of our nursing services. Unfortunately, many people do develop complex wounds which might take a long time to heal. So say every agency has wound care specialists that are trained on what is the most up-to-date and best practice way to help wounds heal as quickly as possible and as best as possible. So care coordinators, we mentioned briefly. In terms of what the care coordinator do, they're kind of the backbone of our home and community care services. So anybody that's receiving home and community care services is assigned a care coordinator who provides what we call this care coordination or case management service. So it's kind of their job to know what's going on with you, what are your care needs, what services do you need, what other resources can we help you access, what have you tried already, what is working, what is not working, just basically to have the good overall picture of what's happening. Care coordinators assess people to determine their care needs. So the assessment and screening tools that we use, they're provincially mandated. So again, no matter where you go in Ontario, the LHIN uses the same screening tools. They're standardized. There's a particular screening tool that we use over the telephone. There's another one that we usually do face-to-face, but with the pandemic, we've been doing some virtual visits. So calling people via video conference and chatting and doing an assessment that way. The care coordinator monitors each person's care plan. So once they've done the assessment to determine what your care needs are, they'll talk with you about what sort of services we can offer and what they think that might help you. We'll set up a care plan together, and then they'll monitor it to see, is it working? Do you need more help? Are you getting better? Do you now need less help? That kind of thing. So they really monitor and adjust that care plan to make sure that it is meeting your needs. It's also our job to help people connect with various care and services. So again, while home and community care offers certain services, it's also a care coordinator's job to know what other resources, what other care, what other services are available out there in the community that again can help people stay home, can help people manage. We do have care coordinators in every hospital in the Champlain area. They're also in the community, so again, normally visiting people face-to-face. Obviously, lots of us are working from home right now, but are visiting people face-to-face as needed, or else connecting by telephone or by video conference. And we wanted to talk a little bit about the differences between retirement homes and long-term care homes, because sometimes the terms are used interchangeably, although they shouldn't be. And sometimes it's confusing. You don't know if a place is a retirement home or is it a long-term care home? What does that mean? So if you wanted to apply to move to a retirement home, basically you just pick a home and you can apply to it. So you apply to the individual home. Either you would apply yourself or you would apply on behalf of your loved one. In general, they're going to accept almost all applications that come to them. really their concern would be, again, unless your care needs are too heavy for them to manage, that would be their main concern. Other than that, they don't discriminate in terms of any other things. As long as you can afford the cost to live there, then anybody can apply to go. So the care that is provided by retirement homes and the cost to live there really varies depending on the home, depending on the size of the room or the apartment that you have there in the home, and depending on the services that you're getting. So the size of the room can vary anywhere from what we would call a sort of bachelor or studio, where you have one room with a bathroom, all the way up to it could be a 2-bedroom apartment, basically with a living room, little kitchen or kitchenette, those kinds of things. So obviously the cost generally is larger the bigger the size of the room or apartment that you have, and depending on the services that you receive. So most of the homes now are operating on a model where there's a certain basic cost per month that you would pay that would include the cost of the room, and for most places some of the meals, if not all of the meals. And then if you need help over and above that basic need, then generally there's a charge for each service that you need. So if you need help either reminding you to take your medications or just to dispense the medications, then generally there would be a cost for that. Housekeeping and laundry is sometimes included in the basic cost and sometimes extra, again, depending on the home. Any kind of personal care generally is extra, again, depending on the home. Some of them may include 1 bath a week, but most of them are moving now to a model where it is extra if you need that sort of help. The regulation for the retirement homes, it's limited, it's mostly voluntary. They are covered by the Landlord-Tenant Act and by the Care Homes Act. And there is the a regulatory home authority that they can sort of choose to be associated with, and then they have to follow those regulations that are set out. So again, it's a bit of an individual sort of investigation, trying to figure out whether this home is a good fit for you. What services do they provide? Not all retirement homes provide the same service. Some of them specialize more in dementia care than others. Most of them will have some type of a secure floor or unit, but again, not all of them. And what does that mean? Is it a locked unit? Is there a sort of code to access the unit? You know, so you kind of have to do your own investigation to find out what does this retirement home offer. In terms of the long-term care homes, if you want to move to long-term care, you do have to apply through the LHIN, through Home and Community Care. You do have to meet certain eligibility criteria. So not everybody is eligible to move into long-term care. And we'll go through later in this presentation what the eligibility criteria are that you need to meet in order to be eligible to move to long-term care. The care that's provided in long-term care homes is standardized, which means they all have nursing care, they all have personal support help, they can all provide physiotherapy services, that kind of thing. The cost is standardized with slight variations, but basically the cost for long-term care, there's a standard cost depending on the type of room that you're moving into. So again, there's a cost for a basic or ward room, there's a cost for a semi-private room, and there's a cost for a private room. And again, we'll look at that a bit later in the presentation to say what does that mean and what are those costs. And finally, they are regulated by the province with public reporting guidelines. So again, to call themselves a long-term care home, they're all registered with the province. They all commit to providing a certain level of care. The province tells them kind of what ratio of nurses and personal support workers they should have based on the residents that they have. And the province is also responsible for doing inspections and providing reports to the public on whether there are any incidents in the home, whether they are meeting their obligations, those sorts of things. So we're going to move on then into, if you've decided that perhaps a long-term care application is for you or your loved one, how do we prepare? What do we do? So one of the first things might be to talk to the person, but obviously that depends on the situation. So some people don't react well to a discussion about long-term care, some people do, but In general, the kind of earlier we can talk about long-term care, the better. It kind of gets people thinking about it and thinking about what they would want, what they would not want, those kinds of things. But again, you know your loved one best. Some of them are just like, don't even talk to me about it. I would never go to one of those places. I'm not interested. That's it, that's all. So again, sometimes a little bit of that guilt comes into play where you're like, well, why am I even thinking about this? I know my loved one wouldn't want it. Unfortunately, sometimes, as we say, we do have to make the decision for them, depending on what's best for them and what their care needs are like, and what kind of care we're able to provide to them. Sometimes it's just not possible to keep people at home as much as we would love to. So next step would be to research information. So attending a preparation session such as this one is great. This really gives you a good overview of what the long-term care application is all about and what the steps are. We do have information on our home and community care website. So that's listed there. It's healthcareathome.ca/Champlain. So there's quite a bit of information there on long-term care. There's a booklet called Planning for Long-Term Care Guide, which is a really good booklet to have a look at. And again, kind of summarizes some of the information we'll be talking about tonight. And then the ChamplainHealthline.ca does have a lot of information on the long-term care homes themselves. So if you go on there and you search for long-term care homes, you can search for ones in a certain postal code, you can search for ones within a certain distance of your home, you can look for ones just in the Ottawa area or just in Renfrew County area or that kind of thing. We did have virtual tours of all the long-term care homes on the Healthline. I think there have been some issues with those working, but at the very least, they'll be able to connect you to the website for those long-term care homes, and you'll be able to see pictures of what the rooms look like, what the common areas look like, that sort of thing, which is really important in this time, because again, our next step normally is to recommend that you book tours of long-term care homes so that you can see what they look like, so that you can talk to the people there. Unfortunately, at this time, that's not going to be an option. So the virtual tours are going to be the next best thing. So I would definitely recommend, as I say, going online, going to the Champlain Healthline so you can at least have a sense as to try and narrow down your search a bit which long-term care homes you might be interested in. There's also a map so you can see all the long-term care homes in the area too and whereabouts they're located. And then once you've narrowed down your search a bit, then you could certainly call the long-term care homes if there are any specific questions that you have for them and ask them over the phone and that sort of way. And that might be the best that we could do at this time until and unless they do start allowing tours again of the long-term care homes. So there are various steps in the long-term care process. So starting with a referral, proceeding through assessment, determining eligibility, evaluating the person's capacity to make a decision about long-term care, obtaining consent, providing counseling, giving your choices, and finally, waitlist and admission. So we'll go through all of those in detail. So in terms of a referral, again, probably number one question is when? When should I think about a long-term care application? So we talked about that a little already. Kelly talked about it a bit. Basically, if your care needs are increasing, so again, we'll look at the eligibility criteria, which will kind of help you again get a sense as to whether or not you or your loved one would be eligible. But besides the care needs, you also have to be willing to accept a bed in a long-term care home if a bed becomes available. So as per the last bullet, you can't apply for long-term care before you're eligible to go or just in case. You can only apply when you can say, yes, once I'm on the wait list, if they call me and a bed comes up, I would be ready and willing to take a bed. If you're not ready or willing to take a bed, then you can talk to your care coordinator about what are the other options out there. So maybe it might be getting more care at home. Maybe it might be looking at a retirement home. But again, unfortunately, we can't put you on the waiting list unless you are both eligible and ready and willing to accept a bed. So if you're already receiving home and community care services, then you can just call your care coordinator directly. If you're not, then you can just call our main number and say that you're interested in applying to long-term care and you'd like an assessment for that. And so somebody then will contact you to get more information and to schedule that appointment for the assessment. So it's really part of the care coordinator's job to inform people and caregivers about what their long-term care options are. So we're very familiar with all of the long-term care homes in our immediate area, at least, and in general across the area of Champlain. We want to ensure that each person's specific care and lifestyle needs can be met in a long-term care home. So some of the long-term care homes do have slightly different quirks, shall we say. Some of them, for example, don't allow alcohol. Some of them are do specialize in a certain religion or that kind of thing. So we'll talk to you about which long-term care homes you're interested in and see if that's a good match for your care needs and your lifestyle needs. And if long-term care doesn't fit your needs, then again, we'd talk to you to help determine what would be the best place for you to receive care. So is it a retirement home? Is it at home? Sometimes people's care needs are too high for long-term care, and then we'd be looking at complex care. So again, it's the care coordinator's job to kind of walk you through that and see, is long-term care a good fit or not? So in terms of the assessment, the care coordinator would complete the assessment to determine a person's eligibility to apply for long-term care. So again, normally this is an in-person assessment in the person's home. During this time of the pandemic, it may be a video conference assessment. It might even be a telephone assessment. It really just kind of depends on the circumstances. But all of the things being equal, we do try to do it in person if at all possible. It's really helpful for us to see the person in their own home, see how they're managing, get a sense of what the home environment is like. There's also a health assessment that needs to be filled out. It's a form. Normally this is done by the family doctor if there is one. It can be any doctor though. It can be a nurse or a nurse practitioner. So it's basically looking at the person's medical history. So if somebody has access to their medical chart, that's really what we're looking at. If the care coordinator completes that assessment and finds that the person is not eligible for long-term care, then again, that's when we talk about what your other options might be. There is an appeal process available. So if the care coordinator says, look, I really don't think that you are eligible for long-term care, but you disagree, then you can appeal that decision and go through the appeal process, and somebody else basically will have another look. Maybe a different care coordinator will do an assessment, and we'll look to see if there's any reason to disagree with that first decision. So here's the eligibility criteria that people are really interested in. So first of all, you do have to be at least 18 years old to apply for long-term care. You have to have a valid Ontario health card. So the only exception to that used to be if you were living out of province and wanted to apply to a long-term care home in Ontario, you could still do it as long as you stayed out of province until the bed became available in the long-term care home. And then the day that you moved here and moved into long-term care, they'd give you a valid Ontario health card. At the moment, the government has waived that 3-month waiting period for OHIP if you move here from another province. So right now, basically, pretty much anybody within Canada who moves to Ontario would get an Ontario health card number right away, so should be eligible to apply to long-term care right away if you're interested. You have to have care needs that can be met in a long-term care home. So again, they can't be too high or too low. They have to be the right level of care needs for long-term care. And there have to be no government-funded community programs that are available or sufficient to meet your needs. So for example, through home and community care, through the LHIN, you can be eligible for personal support help. It's generally a maximum of about 15 hours a week, which is about 2 hours a day. So if you need help with your personal care, but you need more than 2 hours of help a day, then that's when we might be looking at, okay, this government-funded community program is not sufficient to meet your needs. So yes, we're going to be looking at long-term care, that kind of thing. There's not an expectation that you would have to be paying privately for lots of help at home in order to qualify for long-term care. They're looking at those government-funded programs. So you also have to need one of the following. Either nursing care available on-site 24 hours a day. As you can imagine, that one's not that common. Most people that are living at home don't have a nurse there 24 hours a day, so most people don't qualify under that criteria. The next one is frequent assistance with activities of daily living. So again, things like bathing, eating, dressing throughout the day. So again, the keywords there are frequent and throughout the day. So if you need some help with getting out of bed and getting dressed, but that's it, that wouldn't qualify you for long-term care. That would be a one-time thing that could be done by a personal support worker coming to your home in the morning and helping you with that. So that wouldn't qualify you for long-term care. Generally, these are things like, as you say, if you need help with eating, if you need help with walking, if you need help with getting to the bathroom, these are things that happen frequently throughout the day and obviously couldn't be managed by somebody coming once or twice to help you. You need somebody there at frequent intervals throughout the day. So that's some sort of physical assistance that you need. The next one that is more common for people that are diagnosed with dementia would be that daily on-site supervision or monitoring. And again, it's at frequent intervals during the day. So somebody with dementia who is not safe to be left alone, who needs help to make sure that they're not maybe wandering or trying to exit the home, or maybe they're at risk for falls or at risk for doing something else that would put them in danger if they didn't have somebody there to monitor them, that could make you eligible for long-term care. So again, most people qualify either with this one or the one before. Either you need frequent physical help or you need frequent supervision or monitoring throughout the day. There is an exception for couples. So if you want to apply to join an eligible spouse or partner in long-term care, then you don't need to be eligible in your own right. You can apply at the same time as your partner, but you wouldn't be admitted to a long-term care home until they were admitted. So obviously their care needs are higher, they would take priority. And once they've moved into a long-term care home, then they're looking at, okay, how long have you been separated? Who else is on the list to go to that long-term care home? What's their priority? That kind of thing. In a general sense, if this is something that you're interested in, it doesn't have to be married couples necessarily. It could be siblings, it could be parent and child, it could be just somebody that you have a significant relationship with. So generally, this is somebody that you've lived with for at least a year. But if this is something that you're interested in, I would definitely encourage you to be looking at the long-term care homes with the shorter waiting list, because again, just because you're eligible, the length of time you might wait to be reunited if your loved one moves into a very popular long-term care home, you would be waiting a long time to get a bed offer to join them, as other people who have care needs that require them to be there would have a higher priority than you would, unfortunately. And that doesn't apply, by the way, if both members of the couple are eligible for long-term care in their own right. In that case, then they have a very high priority to be reunited within the same home. So part of the assessment includes a capacity evaluation. So the care coordinator evaluates the person's ability to make a decision regarding the application to long-term care. So this is a healthcare decision, which means that we always evaluate those decisions at the time that they need to be made. So nobody can be declared incapable of making all healthcare decisions, even if we know that they're likely not going to be eligible. We still have to do our best to try and evaluate that decision-making ability. So the care coordinator will ask the person some questions, and the questions are designed to figure out if the person understands what their care needs are, and if they appreciate the consequences of not having those care needs met. So it's kind of a twofold test where they have to meet both of those things. So as we say, part of the assessment might be talking about what is their daily routine like? Did they get help with anything? Did they do it all themselves? Those sorts of things. So if we're doing an assessment, let's say with a family member as well, and the person is telling me that, oh, nope, they don't need help with anything, they're completely independent, and the family member is like, well, no, actually, I have to help them get up, and I have to help them do this, and I have to help them do that. That would be a sign, for example, that the person doesn't understand what their care needs are because they think they're doing it all by themselves, even though they're getting help. The other thing is maybe they do understand. Maybe they say, oh, my daughter is helping me with this, and my daughter does help me with that. And we say, okay, well, what if your daughter wasn't here? How would you manage without your daughter? And they say, oh, well, I just do it myself then. If she wasn't here, that's no problem. I don't really need her help. It's nice of her to help out, but I'm fine. That might be a sign then that they don't appreciate what the consequences would be of not having those care needs met. maybe they don't realize that if their daughter wasn't there, that maybe they would be at risk of falling if they tried to do those things themselves, that sort of thing. So we're looking at both of those things. If the person does meet both of those criteria though, if they're considered capable, they do have the right to live at risk. So we do fairly often find people that understand what their care needs are. They appreciate there's a risk to not having those care needs met, and they're like, but I'm okay with that because I want to stay home. I don't want to go to long-term care. I'm going to manage as best I can with the help that I have. Maybe I will hire some extra help privately, but other than that, I will take the risk of staying home. And again, as long as they're capable, everybody has the right to make that decision for themselves. If they're not capable, we do have to let them know that we found them to be incapable of this particular decision, and that their substitute decision maker or power of attorney for personal care will then be the person making a decision for them about applying to long-term care. So we do sometimes get asked if we can make the application to long-term care without discussing it with the person. And unfortunately, we cannot, because we have to evaluate their capacity. And that evaluation does involve asking them questions about long-term care. So we can see, do they understand what long-term care is? Do they understand what this decision means? If we find somebody incapable, they do have the right to appeal that decision. And in fact, we do have to assist them if they need help to appeal that decision. So they can appeal to the Consent and Capacity Board, and that appeal is generally heard fairly quickly. They aim for within 7 days. So it's a board of 3 people with experience in understanding what the evaluation should be for determining somebody's capacity. And they would hear from the person, they would hear from the care coordinator, maybe the doctor, anybody else who has some kind of relevant information. And they would make a decision whether or not they feel that capacity evaluation was done correctly and whether or not they've arrived at the correct decision. So in terms of consent, after we've evaluated the person's capacity, if they're capable, then they would need to consent to the long-term care application. If they're incapable, then we're looking at the substitute decision maker or power of attorney to complete and sign the consent form to move forward with the application for long-term care. So to be a substitute decision maker for long-term care, the person has to be at least 16 years or older. They have to be available. So obviously we have to be able to reach them. We have to be able to have this conversation with them. They have to be apparently capable of making a decision. So we're not going to do a full capacity evaluation of the substitute decision maker, but we will have a bit of a discussion about long-term care and get a sense that you understand what this decision is about. And you have to be willing to make a decision. So nobody can force you to be a substitute decision maker for somebody else. You have to agree to it. There are times when we found, say, a relative of somebody and they're like, you know what, I simply don't know this person well enough. I'm not willing to make that decision for them, and that's absolutely fine. So we go through what we call this hierarchy of substitute decision makers, and this is how we decide who's going to make that decision for the person if they're not capable of making it for themselves. So the first person would be a guardian. If the person has an appointed legal guardian, that person would make the decision for them. Most people don't have that, so the next would be the power of attorney for personal care. So a lot of people do have a power of attorney for personal care. So in that case, if we find the person incapable and somebody is telling us, oh, I have that power of attorney for personal care, then we'd be asking for a copy of that document so that we could put it on file and know that you are the correct substitute decision maker for this person. Next would be a representative appointed by the Consent and Capacity Board. So if you are not a substitute decision maker for someone, but maybe you think that you should be, maybe the person that is their substitute decision maker you feel is not making decisions in the best interest of that person, you can apply to the Consent and Capacity Board, and similarly to appealing their capacity, you'd be appealing and saying, I should be the representative because this person I feel is not acting in their best interest and this is why. And again, everybody relevant would have to appear and present evidence as to why you should be appointed representative or why that person who is the representative should not be, and then make a decision based on that. So following that, if they decided that yes, you were the most appropriate representative, then you would fall here in that hierarchy of substitute decision makers. So next, for people who don't have any of those first three, would be the spouse or partner. So if you're married, if you have a partner, that person would make a decision for you if you were not capable and you didn't have a power of attorney for personal care. Next would be a child or parent, and all children have equal decision-making ability. So this happens quite a lot, where maybe somebody has 3 or 4 children and maybe they disagree about whether an application for long-term care should be started. So obviously we'd talk to everybody, we'd try to get everybody on board and on a consensus as to what we're going to do. But if they can't agree, then the next thing would be to, again, go to the consent and capacity board and say, you know, we have 4 children that cannot agree whether we should proceed with long-term care. So generally, one of the children who wants to proceed with long-term care would go to the consent and capacity board and say, I feel that I should be the representative. I feel this is in the best interest of my parent. I would like to be appointed the one to make this decision. And again, they'd hear the evidence and go from there. A parent with only right of access as opposed to custody would be next in the hierarchy. Next would be brother or sister. Again, all siblings would have equal decision-making ability. Next would be any other relative. So all other relatives at this point are equally ranked. And as a last resort, there is the public guardian and trustee. So if somebody does not have anybody else who is available, willing, and capable to make that decision for them, then the public guardian and trustee will make a decision about long-term care. Now, obviously, they don't like to do that because they don't know the person, they don't know what kind of long-term care home they might want to move to, that kind of thing. And in that case, they would probably discuss with the care coordinator to see, again, what homes are in the area, what does it seem would meet that person's needs, that kind of thing. So again, we do absolutely try and find anybody else who does know the person and who would be willing to make that decision before we go to public guardian and trustee. So in terms of counseling, the care coordinator during this visit will talk about what your concerns are about long-term care and see if they can answer any questions, address any issues that you have. They'll talk you through what the process is and what forms need to be signed. They can give you some information about the long-term care homes. So they can give you an idea of the size of the homes, the features, where they're located, what the approximate waiting times are, that sort of thing. Unfortunately, as you may know, they have had to close some long-term care beds in the province because of the different types of rooms. So as you can see here on the bottom of the screen, they talk about the basic or ward room. That was a room that could have up to 4 people in the same room. And during the pandemic, the government has declared that really there should never be 4 people in the same room. So some of those beds have been closed, which means we've lost some long-term care beds in the area, which means that unfortunately this does make the waiting times longer than they were in the past. Semi-private rooms, generally these are only at the older homes. The newer homes will only have basic or private, because the basic in a newer home, you could be having a room to yourself and just sharing a bathroom with the person next door, or at the very most you'll be sharing a room with one other person, and they're quite often well separated either with furniture or with a wall in between the 2 people. So a semi-private in the older homes means no more than 2 people in the same room. But again, in an older home, those beds might be quite close together and just separated with a curtain. And you might be sharing a bathroom with the 2 people next door. And then private room, again, in a newer home, it would mean a private room to yourself and a private bathroom. In an older home, a private room just means that you have the room to yourself. But again, you could be sharing a bathroom with the people next door. So the costs that you see there, that's as of July 1st, 2019. Normally they go up a little bit each year. This year, due to the pandemic, they kept the rates the same as last year. These rates are the general rates, but as I say, if you're in an older home, they might be a little bit cheaper, not a lot, but you're looking at about somewhere between $1,900 for a basic room, up to about $2,700 a month for a private room. Now, these rates can be subsidized, so if you cannot afford that $1,900 a month, and they're looking just based at your income. They're not looking at your assets. You can still apply to move to long-term care, and the government will subsidize you and allow you to keep a comfort allowance of about $150 a month, so that anybody can afford to move to a long-term care home. So you don't have to worry about that. However, they will not subsidize the cost of the semi-private or private room. So if you want a semi-private or private, you have to be able to afford that $2,700 or $2,300 a month. Note that that rate really is already subsidized and that it represents a cost for room and board, so the room and for the food that you get. The care is already paid by the government, so the nursing care, the personal support care that you might need in a long-term care home, that is already paid for and covered by the government. Short stay rates are a little bit cheaper, so the daily rate for that is about $40 a day. So I don't know that we have many, if any, short stay beds at the moment. So we did have short stay respite beds, which we've talked a little bit about, and I'll talk a little bit about a bit later in the presentation. Temporarily, at least, those short stay beds have been closed due to the pandemic, so that we can have as many long-term care beds as possible. However, hopefully we will get them back in the future. A short stay respite is a really good option for giving caregivers a break while you're waiting for a long-term care or permanent bed. So in terms of how to choose the right long-term care home, often it's a question of identifying what the priorities or special needs are of the person who would be moving there, as well as any priorities or special needs of you or their loved ones or other family members. And you'd want to make sure those could be met in the long-term care homes that you're looking at. Talking to family or friends can be good if you have anybody who has already gone through the process or anybody who has a loved one living in long-term care. But always take it with a bit of a grain of salt. I would say that all of our long-term care homes, there have been good experiences and there have been bad experiences at all of them. None of them are perfect. None of them are absolutely terrible either. They're all kind of a mix of good or bad. So some people might have had a great experience at one home, some people might have had a bad experience. I wouldn't rule them out completely based on just one story, shall we say. Again, ideally, in an ideal world, you would narrow down the list and then book tours of those long-term care homes you're interested in so you could see them in person. But in this time, again, I would recommend visiting the champlainhealthline.ca to access those virtual tours and the home's websites for those pictures so that you can have the next best thing to seeing them in person. You can choose up to a maximum of 5 long-term care homes. In terms of if you're looking to just move somewhere as quickly as possible, obviously the more choices you have, it gives you a few more options in terms of getting a bed offer more quickly, hopefully, but you don't have to choose 5. So again, I can't stress this enough, only choose homes you wish to move to, because once you're waitlisted for homes, they will call you with whichever one has a bed available first. So if you've chosen 5 homes and your 5th choice has a bed first and they call you, you certainly have the option to say yes or no at that point. But if you say no, unfortunately your name comes off the list for all 5 of those homes. You can't reapply for 3 months. And when you do reapply, you start again at the bottom of the list for all of those homes. So there is a penalty associated with refusing an offer for a home that you have chosen. So if you feel really strongly about 1 or 2 homes, then only list those homes. Say that, yes, you're willing to wait until a bed comes up in one of those homes. If you've listed 5 and your 5th choice comes up first, hopefully you're agreeable to go there. If you are, you can go there. And then you have 4 other homes on your list. You can choose to either keep all 4 of them on your list, or you can choose to narrow down your list to maybe only 1 or 2 at that point, since you've already moved to a place where you're safe. I would recommend definitely keeping at least 1 home on the list even after you've moved to long-term care, just so you have an option if after living in that long-term care home for a while you think it's not the best fit, at least you have another one. There's an option that they will call you when a bed comes up at that one. So moving into a long-term care home, doesn't change your priority in terms of how quickly you would move into another long-term care home. It doesn't delay you at all. So in terms of the wait list, once we've got your application, we send them to each long-term care home that you've chosen, and they review your application. If they accept you onto the wait list, they add your name onto their wait list. If they don't accept you, then the care coordinator would contact you to discuss options. This is pretty uncommon. Generally, the care coordinator would be able to let you know that, yes, I don't see any issue, they should definitely accept your application, or, you know, this particular issue means they might not accept your application, so let's apply and see what they say. The long-term care home really can only refuse the person's application if they don't have the physical environment that could meet the person's needs, or if they don't have the care environment, so if they don't have their correct proportion of staff to meet those person's needs. So again, that is generally something the care coordinator would know ahead of time, would be able to give you a heads up about. We do have some waitlist information available on our website to give you an approximate idea as to what the long-term care wait times are like. So it's specific for each home. It does show you, depending on the type of bed that you've applied to or the type of room, approximately what the wait list is like. Now, this is based on historical information. So again, given in the last, 4 to 5 months now, they've decreased the number of beds available. I would say that the wait times that you're seeing there are probably not representative of the wait times that you might have in the future. So I would expect that the wait times will be longer than they are on the website right now, and that will probably correct itself over time as beds get offered and we go from there. People are waitlisted by priority. So primarily it's by the date that your application was complete and sent to the long-term care home. But there are a few things that might make you a slightly higher or a lower priority. So we talked a bit about spousal reunification. If you have a partner that's applying for long-term care and you both have care needs that make you eligible for long-term care, then once one of you moves to a long-term care home, the other person would have a high priority to rejoin that person. If the person that wants to rejoin that person does not have care needs of their own, then they would have a lower priority than other people with care needs. Depending on the type of bed or room that you've applied to. So in general, if you're applying to a newer long-term care home, there will be a longer waiting list for those basic rooms because they're cheaper, but they're basically more spacious or more private than a basic room would be in an older long-term care home. In an older long-term care home, the wait lists for a private room are generally longer. And some of the long-term care homes, in fact, the older ones, have very few private rooms and might even say that you can't apply to a private room from outside the home. You have to move into the home in a basic or semi-private room, and then they have an internal waiting list for private rooms because they have so few available that people internally have priority to move into those private rooms. The level of care that you need can affect how long you're on the waiting list. So basically, when they look at the next person on the waiting list before offering them a bed, they do look at what the care needs of that person is. And based on the care needs of their other residents in the home at the time, then they'll decide whether, yes, we can accommodate this person, or no, we can't accommodate them right now, so we have to look at the next person on the list for now. There's also ethnocultural need. So there are some homes in the Champlain area that do give priority to people of a certain ethnicity or culture. So places like Villa Marconi give priority to people of Italian culture. Hillel Lodge gives priority to people of Jewish culture. The Glebe Center has a unit that gives priority to people of Asian descent, as well as they also have a deaf unit that gives priority to deaf people. So this is generally because people from that culture have helped raise money to build those long-term care homes. So it doesn't mean that anybody can't apply to them. You can still apply, but it does mean that people of that culture would get a higher priority than people that are not of that culture applying to the same home. In terms of being admitted to long-term care, when you get to the top of the wait list and they've looked at the person's care needs and said, yes, we're prepared to offer this person a bed, what will happen is you will get a call from the LHIN, from a placement care coordinator in general, and they will let you know that there's a bed available at this particular long-term care home. They'd be able to give you the room and bed number at that point. And it is a very quick decision at that point. So basically you have 24 hours to respond, unless you're lucky enough to get that call on a Friday, in which case you can have till Monday. But they are pretty strict on the 24 hours. So if they're calling you at 2:30 in the afternoon, they're expecting an answer by 2:30 the following afternoon. That 24 hours is normally enough time for you to go and have a look at that room if you want to. Again, during the pandemic, that may or may not be an option. You'd have to check with a particular long-term care home to see whether they're able to accommodate that or not. But because it is such a quick decision, I would definitely recommend that you take the 24 hours. Even if you know at the time of the phone call that you're going to say yes or no, take that 24 hours to think about it, to see the room if you can, to at least call them if you can't, and try and see some pictures and get a sense that way whether or not this is the right match for you or for your loved one. Once you get that decision, if the answer is yes, then they're going to expect you to move in again fairly quickly. If the room is available right now, they're going to say, great, it's available tomorrow. Can you get here tomorrow? For a lot of people, they're going to be like, whoa, that's a little too quick. And you can ask for these bed holding days. So it's up to a maximum of 5 days that they will hold that bed for you before you have to move in. Now, a lot of homes don't do admission on the weekends, so you may not have the full 5 days depending on when you get the call and when the bed is available. But let's say you get the call today, it's Monday. So you take till Tuesday to make your decision and to let them know yes or no, because that's a free day you're not charged for. And then you say yes, and you say, I would like the bed holding days. Can I have the full 5 days, or what's the maximum amount of time I can have? And again, depending on whether or not that home does admissions on the weekend, you might be able to go all the way up to Tuesday, Wednesday, Thursday, Friday, Saturday, or maybe only Friday if they don't do admissions on the weekend. There is a charge associated with that. It's not a lot. It's about $100 a day or so. But again, for some people, it's worth it just to get those extra few days to kind of wrap things up and get ready and move the person. The bed refusal regulations we talked a bit about already. So again, if when that call comes, you've changed your mind and you decide to say no, then you come off the list for that home and any other homes that you're waiting for. You can't reapply for 3 months. And when you do reapply, you start again at the bottom of the list for any of those homes. So we definitely recommend people, if you're on a waiting list and you're sort of having second thoughts, maybe having some doubts, definitely better to call ahead of time before you get that bed offer and say, you know what, I changed my mind. Can you take that choice off the list, or even can you take my name off the list altogether? At least that way you wouldn't have the penalty. Again, if you change your mind about a particular home, then get that one taken off your list so you don't get a call with a bed offer for that home. As a last resort, if you get the bed offer and you're not sure about it, but you're concerned about that penalty, just so you know, if you say yes, and if that person moves into the home on a trial basis, there's no law or anything that says they have to stay there permanently. Have them move in, have them give it a chance, see what they think. Maybe it will work out better than you think. If it doesn't work out, then you can always bring them back home or wherever they're coming from. And in that case, that doesn't count as a bed refusal. As long as they've spent at least 1 night in the home, then there's no penalty. Their name doesn't come off the list for the other homes. So again, it's a way of, if you're not sure, I would certainly recommend saying yes rather than no, and at least trying it out and seeing, again, maybe it will work out better than you think. As Kelly mentioned, it can take a while for somebody to settle in when they first move to a long-term care home. So don't expect miracles, don't expect them to move in and be super happy, be like, this is wonderful, I don't know why I didn't do this years ago. Most people are going to have a bit of an adjustment period. So it's quite normal for them to take about a month or so to settle in, to get used to the routine, to get a sense that, yes, I understand what this place is about, I'm feeling more comfortable, I'm getting to know the people here. So again, if somebody moves in and the first day they hate it and they're begging you to take them home, don't be surprised surprised, but try and bear with it, try and talk them through a little bit, try and get them to give it a chance and to see how it goes, because most people do settle in and do become quite comfortable in the long-term care home. There is something called crisis placement. So if a crisis happens, then your family member can be moved to long-term care more quickly. So quite often this might be that maybe something happens to the caregiver. Maybe they become ill and can no longer provide that level of care that they've been providing to the person. So if a crisis happens, then call the care coordinator, and she will talk to you about, does this meet our criteria for a crisis? And if it does, she's going to encourage you then to add as many other long-term care home choices as you can in order to speed up that placement process. So this is where maybe things were going okay and maybe you had just 1 or 2 homes on the list. If a crisis happens, they're going to say, okay, you know, obviously you're in a crisis. You can't now afford to wait for those beds to become available at that 1 choice or those 2 choices. What other choices would you be open to in order to get this person to a long-term care home, which might not be your first choice, but will at least be somewhere where they're safe and will be taken care of while they wait for their first choice. Again, it doesn't delay their placement at their first choices, but it can get them somewhere quicker, safely, so that they're taken care of despite this crisis situation. So in that case, you could choose not only up to 5, you could choose even more than 5. So as I say, they'll really encourage you to say, let's look at all the homes that might be options, and that way we can get you in whichever one of these has a bed open first. If you had only 1 or 2 choices, then the likelihood that they're going to have a bed come open really quickly is going to be fairly low, which is why we're encouraging you again to have a look at all the choices and to open up as much as possible. We would never offer you a home that you haven't chosen, but we would encourage you in that situation to have as many choices as possible to increase your chances of getting placed more quickly. So we talked a little bit about short stay respite. As we say, unfortunately, it's not available right now, but when it is available, it is a great option to help caregivers keep managing while they're either waiting for long-term care or even before they've applied for long-term care. They do have to meet the same eligibility criteria for long-term care. So it might be something where you say, you know what, I'm not ready for a long-term care application right now, but we could try the short stay respite and see how it goes. So it's available for a maximum of 90 days in a calendar year. Generally, it's a 1-week minimum stay. So again, that's to give the chance for the person to settle in a little bit and for them to establish a care plan and a routine for that person. And it's generally up to a 1-month maximum stay, possibly up to 2 months by exception, depending on the circumstances. So sometimes people will ask for short stay respite stay if they're planning a vacation themselves and going away or something like that. So then we'd be looking at particular dates. Other times people are like, it's just to give me a break. I'm going to be staying home and just resting and recovering for a little bit. It's not available everywhere. Even when it is available, there's a limited number of beds and they're only in specific long-term care homes. So if it is something that you're interested in when they become available again, I would recommend that you don't limit your choice in terms of which long-term care home you'd like to go to for short stay respite. If the important thing is that you get a break or that you have a chance to go on that vacation, then be prepared that it could be any long-term care home in the area that has a respite bed available. So here are some other resources about long-term care. So in terms of those co-payment rates that we looked at for the long-term care rooms and other long-term care information from the Ministry of Health, that can all be found on the government's website. That's under ontario.ca, and there's lots of information there about long-term care. On the Champlain Healthline, we do have a document that has frequently asked questions about long-term care that many people do find helpful. We talked a bit about those inspection reports for long-term care homes from the government. So this is the website where they're available, publicreporting.ltchomes.net. So you can go in and look at particular long-term care homes and see what was the result of the last inspection report, what sort of incidents that they had, how did they respond to them, those sorts of things. Yourhealthsystem.ca is a website by, I'm going to say CIHI, the Canadian Institute for Health Information. It compares long-term care homes on a range of quality indicators. So it can be kind of interesting when you're looking at making a choice between different long-term care homes. You can compare some of them on things such as how long does it take wounds to heal at that long-term care home compared to other homes in the area, compared to province-wide, that sort of thing. So it can be kind of interesting and might help you make a decision if you're struggling between different long-term care homes. And lastly, we did talk about the Champlain Helpline in terms of looking at what long-term care homes there are, looking at the virtual tours. There is information on adult day programs. As we say, Kelly mentioned the day programs a little bit. Day programs normally are, again, another good chance for respite for caregivers. Again, they're not operating exactly the same right now as they did before the pandemic, but some of the community support service agencies are still operating some modified day programs. So if that's something that you're interested in, again, you can always ask your care coordinator if you have one. You can have a look on the Champlain Helpline. You can talk to your Dementia Society person if you have one, and they can give you information. So our number, if you need to reach us, there is one provincial number, 310-2222. You don't need to dial the area code. What it will do is it will automatically connect you with the LHIN in your area. So normally that's good. The only time it's not great is if you try to reach a LHIN in a different area, in which case, by all means, when you get through to this number, you can ask them for the local number for the LHIN in your area. But the phones are all answered by bilingual information referral specialists that would hopefully be able to answer any questions that you have. And if not, then again, they can take your information and they will have a care coordinator contact you to do an assessment. Our website, again, healthcareathome.ca, is for all the LHINs province-wide. So if you go to that website, you can choose the Champlain LHIN from there or another LHIN, if you're looking at a LHIN in a different area, to get to our local websites. And I think that's it. So that brings us to the end of our presentation today. Did we have any questions or anything, Kelly? Did you?
We had a couple of questions that I went ahead and answered live to the chat. So, yeah, so I wonder if anybody has any questions that they'd like to put into the chat at the moment before we sign off. And I think, oh, we have a raised hand. Wonderful. Do you want to go ahead, Gilnes? You're just muted. No problem. We'll just. Oh, I think I heard her. Unmute.
Myself? Does that work?
Yes. Hello.
Can you hear me?
Yes.
So thank you very much for the presentations, for both of them. They were very helpful. I guess the one thing that you didn't really address, although, you know, I think that it is really pertinent for all we spouses out here wondering what to do and when to do things. You know, sort of how do you get yourself emotionally ready to make these big moves? I mean, I know that it's sort of like it sounds kind of straightforward when you put it all together the way you have, which is that, you know, when you can't cope, you address your care coordinator, et cetera, but I guess the question would be, for those of us who are really feeling the guilt, the super guilt about all this, I guess there isn't really much that the system per se can offer. We just have to try to deal with this through our own support groups to try to figure out how to manage this making the decision. And there also isn't much that you guys can give to us to help us make that decision, because as you know, when you're dealing with somebody with dementia, some days it's good, some days it's not so good. And so the question becomes, you know, when actually do you tip over the point where you decide, really, this is not working for me, and probably not for that person as well. Anyway, I just wondered if you had any comments before we all sign off.
Yeah, I think thank you so much for sharing a bit about your own situation. You know, there's an emotional reality, and then there's a factual reality of what's happening.
Mm-hmm.
And sometimes the reality, you know, decisions have to be made so much faster than the time that our emotions need to kind of digest and maybe not accept, but at least, you know, become open that this is happening. And so working with a care coordinator or a LHIN, a LHIN care coordinator or a dementia care coach is helpful because it helps with those, you know, the resources, the decision making, where to reach out for the best information. But there's also a need to talk about kind of what you're going through, your unique situation, and having someone kind of normalize that for you and validate it. And also to hear back some of the things you're doing for your loved one. That's important to hear too. As much as this person is changing, you're changing, and your relationship is changing. So although the timeline doesn't allow for us to grieve and digest, we still need to allow for that natural process to happen. You know, so you mentioned support groups, and we do have those, and there's a lot of spouses that participate in these groups, and that's wonderful because it like I said, normalize and validate and, you know, talk about the ups and downs of life and the black and the white of it, you know. I think that's such an important piece, along with getting the right resources, the right information, making sure you're making the right decision. I'm not sure if that's helpful at all, but you know, there's a wellness, there's a piece of counseling and supportive services and are so important to this transition and this change, because it's a dyad going through this journey, or it's a family going through. It's not always just one person.
Right. Thank you very much. That's helpful.
Good. And you know, we really appreciate everyone taking time out of their, I'm sure, busy days to listen to us and be with us. So we really appreciate that, and do feel comfortable to reach out and chat and let us know what you need, because we'll be happy to be there for you. I don't know if Elaine, you wanted to add anything, or if we have any other questions. Or just coming to the end?
I think, yeah, in terms of support, obviously the care coordinators are there to support you as well. We understand this is a difficult decision for most people. And I think we can offer that support of, yes, you know, like, you're not alone. Lots of people are going through the same thing. Try and reinforce that, yes, if this person's care needs meet this, if you're not able to care for them, that kind of thing. But again, back to Kelly, I would say we often are referring to the Dementia Society in these cases, so that, as you say, you know that you have a dementia care coach that is there to support you, the caregiver, that you got access to those support groups so that you can link up with other people that are going through the same thing. And as you say, have that chance to vent, have a chance to understand how other people have coped with it, any coping strategies they may have found helpful, that kind of thing.
Yeah, great. So I will just thank you so much, Gilnes, for sharing your question.
You're welcome.
Oh, we have just another question here. So if your loved one is living in a retirement home, how do you know when it's time to make the switch to LTC? That's a great question, and I'll just add a few points. So there's always a director of care or of client services or person services. So that's the person that will kind of connect with you when they feel that the needs of the resident have outweighed the care of what they can provide in the environment. And that will be discussion amongst all of you to then talk about next steps. Elaine, I'm not sure if there's anything you wanted to add.
Yeah, I mean, basically, I would say, as you say, again, if your care needs are increasing, so if you're having to pay for more help from the retirement home, then definitely I would say it's time to think about long-term care, and is that something that they would be eligible for, and is that something that you're interested in at this time? Many people, in fact, just stay in retirement homes the whole time and never move to long-term care. So it's not an inevitable progression. It's really an individual decision based on your loved one's care needs, how they're managing at the retirement home. And unfortunately, reality is it is often based on the financial situation, because of course, the more help that you need, generally the more expensive it is in a retirement home. Whereas at least, you know, with long-term care, it's one price regardless of how much care they need. So.
All right, so that comes to the end of our time together. Thank you so much for joining us, and I believe the recordings will be available on our YouTube channel and our online learning. All right, well, take care, everyone, and be well.